Welcome to Hamilton, Ontario, Canada. Hamilton is located on beautiful Lake Ontario, and this is an iconic view of the city, complete with the steel mills that made the city famous in its industrial era. Welcome to the David Braley Research Institute, which is home to the Population Health Research Institute, or PHRI, on the campus of Hamilton General Hospital. Hi, I'm Tara McCready, and I'm the project manager for the Hope For project at PHRI. I'm afraid none of our investigators from Malaysia or Colombia could be with us today, so instead I'm showing you this beautiful map from the lobby of the Population Health Research Institute. It's our pride and joy, as we are very, very proud of the fact we do global studies in more than 80 countries internationally. Hi everybody, this is Robbie Newlett at the Population Health Research Institute. We just got off the phone with the London School of Hygiene Tropical Medicine group and with Rasha Khatib in Palestine, and Robbie's going to tell you about his role in Hope For.
Hi, so I'm Robbie Newlett. I'm Assistant Professor at Clinical Epidemiology and Biostatistics at McMaster University, and also a researcher at the Population Health Research Institute. I've gotten my PhD in Clinical Epidemiology from Maastricht in the Netherlands. My role on the Hope For project is to coordinate our component 1, which is assessing barriers to appropriate hypertension care. And I'm also involved in designing the randomized controlled trial based on this barriers assessment.
My name is J.D. Schwollen. I'm an interventional cardiologist here at Hamilton Health Sciences. I'm an assistant professor at McMaster University. I did most of my training here at McMaster, but I'm just in the process of completing my master's in epidemiology with a focus in knowledge translation, working with Jeremy Grimshaw. My role in the Hope For project is to help with the development of the non-physician health worker curriculum. I'm also helping design the community cluster RCT, which we're very excited to get started on that.
Hi, my name is Dr. Peter Liu at the University of Toronto and University of Ottawa. Together with my colleagues, we're very excited today to have a strategy session for our newly starting DREAM Global study, which is really aimed in controlling high blood pressure challenges in both Aboriginal communities in Canada as well as globally in low and middle income countries such as Tanzania and South Africa, and where we will use novel cell phone based technologies trying to detect high blood pressure earlier and try to find ways in which we control the blood pressure and actually teach the patient in terms of reaching better cardiovascular health. Hopefully we will be able to take the learnings of this program and be able to propagate it to other countries and to really make a difference in terms of the cardiovascular outcomes of people around the world, and to really help us to understand how to control chronic diseases.
Hello, my name is Feng He. I'm a senior research fellow at the Wolfson Institute, Queen Mary University, London, the United Kingdom. Our study is to test whether an education program targeted at school children can lower salt intake in children and their families. In this study, we will educate primary school children on how to reduce salt intake. Then we will empower children, asking them to deliver the salt reduction message home to their families, particularly to the person whoever does the cooking and prepares food for the whole family. This program, if successful, will lower salt intake in both children and adults. The immediate benefit for adults is to lower blood pressure and reduce the risk of stroke, heart attack, and heart failure. For children, this will prevent the development of high blood pressure and cardiovascular disease later in life. Another important feature for our study is that we are going to set a new model to improve public health. Instead of the traditional way of using healthcare system we are going to use the primary school education system. Because universal primary education is a common goal in most national education policies, our approach will have a greater impact compared to the usual healthcare system, which in most low and middle income countries focuses on treatments only and has little capacity for prevention. Our study will be carried out in Changzhi, northern China. Our co-principal investigators include Professor Yang-Feng Wu at the George Institute, China, and Professor Graham McGregor at Queen Mary University of London. We have several investigators in Beijing and Changzhi, China. We also have investigators in Australia. Our study has wider implications. Despite the study being carried out in China, the education program could be adapted by many other low and middle income countries, where the majority of salt in the diet is aided by consumers. A reduction in salt intake across the whole population, even by a small amount, for example 1 gram a day, will have a major impact on reducing the number of strokes, heart attacks, and heart failure in the population, and also save money to individuals, their families, and the health service. Thank you.
Hello, I'm Margaret Thorogood and I'm Professor of Epidemiology at the University of Warwick in the UK. But I'm also an honorary professor at the School of Public Health at Wits University in Johannesburg. And I'm going to be working on this project with my co-PI, who is Jane Googe, who's the Director of the Centre for Health Policy at Wits University. We've been working in the area of chronic disease, care of chronic disease, and particularly hypertension for over a decade. And we know that there is a very high prevalence of hypertension. So in this study that we're going to be doing, we're planning to test a health service intervention to address both the detection of hypertension and the adherence to treatment, the management of hypertension. We're working in an area called the Agincourt Research Site, which is in the far northeast of South Africa, in a rural area, and what we want to do is to try out whether putting lay health workers into the clinics to help to support the nurses will improve both the number of patients who get their blood pressure measured and also the management of hypertension, the routine management of drugs and call back for review and so on. And thank you.
My name's Amanda Thrift and I'm here in the Rishi Valley with part of our team that's doing a project on controlling hypertension and barriers to hypertension control in 3 very different rural regions of India, each at a different stage of the epidemiological transition. This is the Rishi Valley region. The other 2 regions are the East Godavari region in northern Andhra Pradesh and a region in Kerala. And I'd just like to introduce a couple of the key members of the team, Dr. Kartik, who's a principal investigator, Dr. Kamakshi, who's also a principal investigator, and Professor Evans as well. Would you like to say a few words, Dr. Kartik?
I coordinate the Rishi Valley Rural Health Centre, which works in this very arid, drought-prone zone. We work with the below poverty line rural families. We've been seeing a whole lot of hypertension and diabetes amongst people who are not supposed to have these diseases, and we're wondering why, and let's hope that with this project we're able to find out the cause factors and address them rather than just treating them. Kamakshi?
Yes, we have over the last 13 years have noticed that there is a fairly high incidence of high blood pressure and diabetes, and the questions which we are having in our mind were possibly the same that Dr. Mandy and Dr. Evans were having, and it is just that it's been a very good effort that we have put in so far, and we would be putting in to address these issues.
My name is Praveen and I am a Senior Research Fellow with the George Institute for Global Health in Sydney, Australia. I have been a health researcher for the last 4 years and I worked with the George Institute's India's office. We at the George, along with our co-collaborators from Centre for Chronic Disease and Control in India and Institute for Biomedical Engineering in Oxford, are working on a project, a smartphone-based clinical decision support system for primary healthcare workers in India. This study aims to develop and test an approach to empower physicians and healthcare workers in rural India. This smartphone also utilizes a software to detect and manage the cardiovascular risks factors like hypertension, diabetes, and high cholesterol. A healthcare worker takes this smartphone to the field, visits a household, asks a few basic questions for risks of hypertension and cardiovascular diseases. She also conducts basically a few tests like blood pressure and blood sugar measurement. The software in turn tells us the risk of a cardiovascular event in the next 10 years. This information is also transmitted to a server securely, which is accessed by a physician who provides ongoing management to the patient. This research has the potential to influence the health outcomes of the underserved rural population in India. We really look forward to bring to you the results of this study.
Hi, my name's Dr. Ruth Webster and I'm a researcher at the George Institute for Global Health here in Sydney, Australia. I'm really excited to be a part of the Global Alliance for Chronic Diseases call for hypertension research grants. Our team is led by Professor Anushka Patel and includes people from our offices here in Sydney, as well as our offices in Hyderabad, India, and also the Centre for Chronic Disease Control in New Delhi. Our project is aiming to reduce the burden of high blood pressure amongst Indian patients by using a 3-in-1 blood pressure lowering pill, which has the potential to lower the number of pills that hypertension patients take to just 1 pill once a day. It also has the possibility of reducing the number of doctor's visits that it takes to bring your blood pressure under control. We're really excited about the possibilities of this triple pill, as we call it, and we really look forward to bringing you the research results when they're available.
Hi, my name's Bruce Neal. I'm a researcher working at the George Institute for Global Health at the University of Sydney in Australia. Our project brings together colleagues working at the Public Health Foundation of India in New Delhi and the George Institute offices in Hyderabad. The topic of our proposal is salt reduction. What we seek to do is gather the information required to set up a salt reduction program in India. The reason that we're interested in doing this is that diet-related ill health and chronic disease are now major causes of disease burden in the country, and salt is almost certainly an important part of this. We hope to be able to have a really significant impact on the health of literally millions of people in India as a consequence of our work, and we look forward to bringing you the results.
My name is Jackie Webster from the George Institute for Global Health in Sydney, where I manage a small team responsible for food policy. One of the issues we've been working on for some time now is salt reduction. Salt has adverse implications for health. Too much salt causes blood pressure to rise, which is one of the biggest contributors to heart disease and stroke around the world. One of the regions where we've been doing work on this is the Pacific Islands. The project here is an exciting new opportunity because it brings together researchers from the Pacific Islands with other research from Deakin University and the George Institute to look at the cost effectiveness of reducing salt intakes in the Pacific Islands. By doing a robust assessment of salt intakes and sources of salt in the diet, we're going to be able to develop comprehensive strategies to reduce salt intake and then look at the results. There'll be lessons here both for the Pacific Island countries we're working in, but also for the rest of the region. We look forward to bringing you the results.
Hi, my name is Antonio Bernabé. I am one of the investigators of Crónicas, Center of Excellence in Chronic Diseases at the Universidad Peruana Cayetano Heredia in Lima, Peru. I have a master's degree in public health, epidemiology and biostatistics, and I'm responsible for the Crónicas study and now for this new project. The center is headed by Dr. Jaime Miranda, one of the PIs in this new study and now on holidays. Our center has several projects. One is the Chronicas cohort, a cardiopulmonary cohort. Second, an intervention to evaluate the impact of mobile health on the progression of prehypertension in urban areas in Latin America, with collaboration of Argentina and Guatemala. And the third study is a study to improve diet in community kitchens for preventing non-communicable diseases. The new project we have is called Launching a Salt Substitute to Reduce Blood Pressure at the Population Level in Peru. We want to implement a step-by-step trial design to replace common salt for a salt substitute to reduce blood pressure in others in Tumbes, a city in the north of Peru. We want to involve a lot of villagers, but also community leaders, local leaders, as well as national and regional authorities. We believe this project can be the first pragmatic trial in Latin America, and if successful, it can help us to guide policymakers to implement intervention strategies in similar settings. Thank you.
Hello, my name is Benga Ogedegbe. I am a professor of medicine and population health at New York University School of Medicine in New York City. In collaboration with my colleagues, Professor Jacob Plandreau from the Kwame Nkrumah University of Science and Technology in Ghana, and Professor Richard Cooper from Loyola University in Chicago, I will be leading the Hypertension Task Shifting Project in Ghana. The goal of this project is to compare the effect of two strategies for blood pressure management on the level of blood pressure control among 640 patients with high blood pressure who are recruited from 32 community health centers in the Ashanti region of Ghana. The first strategy, we will teach community health nurses to deliver hypertension care using the World Health Organization cardiovascular risk management package. The second strategy, we will provide patients with national health insurance cards that allows them the opportunity to actually receive care without having to incur high out-of-pocket costs. What's exciting about this project is that for the very first time, we would have the opportunity to actually see how task shifting of duties from primary care providers to community health nurses will lead to improvement in blood pressure control. More importantly, we would be able to compare how sustainable this intervention would be at the end of 24 months. What's unique about our project is that it allows us the ability actually to start to address the issue of the workforce shortage globally in sub-Saharan Africa. In other words, we can save physicians and primary care docs for management of the more complex chronic diseases, while we can train community health nurses to deliver really protocolized, uncomplicated blood pressure management for patients who are seen in rural settings. I look forward to meeting a lot of you in our program, and I think this program provides me the opportunity to actually collaborate with other investigators in the field. We also have a training program funded by Fogarty to actually train cardiovascular researchers in the West African region, specifically focused for now on Ghana and Nigeria. So this project will provide us a laboratory to actually train these future leaders of cardiovascular research. I thank you.
My name is Jemima Kamano. I come from Kenya, in a rural town called Eldoret in Western Kenya. And I'm involved in this project for optimizing linkage for hypertension in rural Kenya. The need for this project came about because of a high burden of disease that is being experienced in our country currently, and probably in the whole world, on cardiovascular diseases. We therefore started a project where we do door-to-door testing for screening for hypertension and diabetes and HIV. We ran into problems soon because we realized that though we would screen and advise patients to go to the health facilities, they actually, majority of them don't. And so this project seeks to address to us why we actually are failing at linkage, and to also get solutions that we can then implement to improve the linkage part of this and be able to treat hypertension and other cardiovascular risk factors in time.
We are involved in a very exciting project. 24 communities in Western Kenya, with 5,000 individuals in each community, and approximately about 1,000 people out of the 5,000 have hypertension. And the question is, can we link these hypertensive people to a health system? Can we retain them, and can we control hypertension? The project has three objectives. The first is to test the system of education and performance of the community health workers, as well as the electronic tool that is going to be used. The second, most importantly, are the results. Are we successful in linking this hypertensive community to the health system that we are developing and retaining them? And of course, are we controlling blood pressure appropriately? And the third objective has to do with economics. Is this a good, cost-effective way to treat hypertension? I would say that our excitement is not only based in what has been achieved in communicable diseases, but we think this can be a model in two different ways. One is this model in Western Kenya can be transported to the rest of the world if it works. And second, the co-partnership between the International Global Alliance for Chronic Diseases, the United States Enterprise, AMPAD, and the government of Kenya. This is a real model for the future in really attacking chronic diseases in the rest of the world. Thank you very much.